You're listening to ND Works, a podcast for the Notre Dame campus community, produced by the Office of Internal Communications. We're the team that brings you ND Works Weekly, ND Works Quarterly, The Week at ND, and a passion for sharing clear, concise, and interesting information with faculty and staff of the University of Notre Dame. I'm Natalie Davis Miller, Managing Editor of ND Works, and I'm glad you're listening. Today, we're with Dr. Ben Garman, who is the Medical Director of the Notre Dame Wellness Center, and Vince Workman, the Wellness Center Pharmacy Manager. Welcome.
Hello.
Happy to be here.
So we're here to talk a little about the benefits available to our employees through the Wellness Center and the Wellness Center Pharmacy. I have personally been to both, and I've used them both a lot, and I just really would like to share these benefits and the opportunities with our employees. Let's start out with talking about the Wellness Center a little bit. It's located here on Notre Dame's campus at the corner of Wilson and Bullock. Can you tell us, Ben, a little bit about the recent renovation and the inherent benefits?
Yeah, I'd be happy to. So recently, within the last 2 years, we've renovated our building significantly and more or less doubled in size, which has really increased our capacity to see more patients during the day, to add more store space and functionality to the pharmacy, and to even add new lines of services that we didn't have on site before. During the pandemic, our volume of patients increased so much that even after the pandemic had gotten to a place where none of us had to work remotely, all the providers had to work remotely about 20% of their schedule because I didn't have enough space to put everybody. And so with the renovation, now there's enough space for everybody to work in the office and see patients that much more. In addition, we gained the ability to hire additional staff and providers, which has further expanded our capacity to see patients and serve the community.
That's awesome. And I remember before the expansion that the pharmacy was smaller. And so do you want to talk a little bit about that, Vince?
Yeah, with the renovation, we significantly increased our space. Our previous footprint is currently all over the counter products. So what we had pre-expansion is now all over the counter sales, and we doubled the size of the pharmacy. Because of that, we're able to service a lot more people, and you'll see if you come in and visit us that we're able to have more medications in stock and ready for people than any pharmacy in the area.
Oh, wow. Okay. How many providers do you have at the Wellness Center, Ben?
Yeah, so we have 9 total. We have 5 physicians and 4 nurse practitioners. And that includes a number of different types of services within that group. So we have 7 providers who provide primary care or kind of like family medicine or pediatrics or a combination of the two. And then we have a team of 2 that also do acute care, which is kind of like an urgent care. For more like same day visits or next day visits if like your primary doctor or nurse practitioner can't fit you into their schedule quite as quickly as you'd like.
Very good. And how many pharmacists do you have? Or are they pharm techs or what are their titles?
So we have 4 pharmacists and 6 technicians. The 4 pharmacists, if you go to a local pharmacy, you'll see you're lucky if we'll have 1 pharmacist on staff. We generally, at any given time, will have 4. We have Anne, who's our diabetes educator. The increased space has allowed us to hire a diabetes educator that is also a pharmacist that has her own designated space in office to see patients. And then we also have Laura, who her big focus is vaccines and immunizations is her passion. And then Jenny, who's our blood pressure guru. She sits down and works with people on blood pressure and cardiovascular disease. And then there's me, Vince, and I'm more of the baby kisser.
Okay. All right, Ben or Dr. Garman, can you tell us, and I'm going to ask you both this question, what does it take to be able to use the Wellness Center?
Yeah, so our patient population is limited to anybody who is benefits eligible at the university and then their dependents. And so you don't have to technically choose to take medical benefits as part of your employment at the university to see us, but you have to be eligible to take those. And so I can't see anybody in town. I can really only see folks who work for the university and then their families with a few very specific exceptions.
So here's a question then to throw this out. So my spouse does not work at the university, but is benefit eligible. Now, what if he has benefits somewhere else? Can he still take advantage of coming in for a shot or a blood draw or going to the pharmacy? Is that still benefits eligible?
Yes. So whether your spouse had a job and has his or her own benefits at all, because you work for the university or in benefits eligible, I can see your spouse and any of your children who are 26 or younger.
Okay, very good. Thank you. And what about you, Vince?
Yeah, we're the same. All full-time benefit eligible faculty and staff and their families. In the pharmacy, we can also service early retirees that stay on Notre Dame's plan. One thing that we can do in the pharmacy they can in the clinic side is that we can service your pets' medications. We have a lot of that because our prices are different than the rest of the network of pharmacies. We can accept almost any plan out there as long as they're contracted with Walgreens, and we cannot accept Medicaid or Medicare prescriptions.
Okay, so you cannot. Okay. So you brought up pets. I have a pet. My pet always needs medicine, which leads nicely into my next question. What are some of the most underutilized benefits of both the Wellness Center and the pharmacy? What's out there that you would love people to come in and take advantage of?
Yeah, so I'll go first. I'm always surprised every year that there still seems to be a lot of folks on campus who don't know that we do primary care at the Wellness Center. In the very beginning stages of the Wellness Center, most of our focus was on acute care, and that evolved a long time ago. And so one of our key lines of service is primary care, whether you're an adult or a child. I have 2 pediatricians as part of my provider team as well. And so every year I'm gently reminding plenty of people on campus that, oh yeah, if you need a primary doctor, we'd be happy to help you out with that. Otherwise, we also provide travel medicine. 2 of my doctors specialize in travel medicine. And so if you're traveling to a country where perhaps there's some more exotic infectious diseases that you might benefit from a vaccine from, or some anti-malarial prophylaxis, or even just some advice on like, don't eat or drink this or that, or stay away from this or that to avoid getting sick. We service a lot of folks at the university who travel, whether it's work-related or non-work related. And then we also have a behavioral health wing that provides nutrition and care management services, as well as a number of wellness coaches. I like to describe my wellness coaches as somewhere between a personal trainer and a therapist, while being neither. And so they're not exactly going to psychoanalyze you on their couch, but they're really good at helping people who have a lot of work stress, which is not a foreign concept at the university from my experience, but also helping people lose weight and exercise, and even just helping them find time in their schedule to do all those type of things.
Is there a cost for the wellness coaches?
So for both my wellness coaches and my dietitian and care manager, there's no cost to the patient. There's no copay. It's completely free. And if anybody would like to schedule with either of those folks, all they have to do is either talk to my front desk or give my front desk a call.
Okay, very good. Did you have anything that you wanted to add to what he just said, Vince?
Yeah, the pharmacy, there's a few things that I think are underutilized. One is vaccines. We have several vaccines that we're contracted to provide at no charge that you can't go anywhere else in the network to pharmacies to get. For example, shingles and RSV are 2 of those that many people go to the community trying to get those vaccines, and they're told that's not covered and they have to pay cash, when in reality, if they contacted us, it would be no copay for them. The other ones would just be the fact that we can provide 90-day prescription services where the rest of the network cannot. And I'm actually surprised the number of people that come in and we see come in for an acute care event, and we say, hey, why are you filling it at another pharmacy? You can get 3-month supply, often for less money for a 3-month supply at our location than they're paying per month out in the network. And then probably clinical pharmacy. And our clinical pharmacist, that is our diabetes educator, her program is growing, but she's able to see and help people, particularly that have diabetes, that need a little help getting on track. And she's fantastic working with them.
Very good. So what about things like allergy shots? Do you do those?
Yeah, so we do allergy shots at the Wellness Center. We don't initiate allergy shots, and so a patient would have to have already been established with an allergist and gotten their first dose or two at the allergist's office, and then we coordinate with that office to then continue the rest of their course at the Wellness Center, just to make it more convenient and help the patient save a little bit of money.
I love that you're coordinating and working even with an outside office. Okay, and what about if you have kids and you know how they get those forms filled out and they might need vaccinations, you take care of all that as well?
Absolutely. We have 2 pediatricians at the Wellness Center. So Dr. Tony is primarily a pediatrician. And then our most recent addition to the team, Dr. Kilpatrick, is dual board certified in pediatrics and internal medicine. So he can function as either. And both of them see children every day that they're at the Wellness Center. And then we also have 3 family medicine physicians, including myself, who aren't pediatricians, but we see kids very routinely as well.
Okay.
And we can do yearly physicals, whether they're just a routine physical or a sports physical. And typically, as long as you've had one of those within the last 6 to 12 months, a lot of times we can fill out that type of paperwork as well.
Okay, so you mentioned physicals, and I've not had a physical where they didn't ask me for lab work, and I take it you do that as well.
Absolutely. We have a lab on site. We can do a number of routine point of care tests within the walls of the Wellness Center, like testing you for perhaps a urinary tract infection or strep throat. And then anything else that we don't have the capacity to run within the walls, we send a lab core that day. And any lab drawn at the Wellness Center, with a few very specific exceptions, incurs no charge to the patient.
Okay.
Whether they were ordered by us or even an outside order from another physician. So say you had an endocrinologist or a cardiologist and they wanted you to get some blood tests done, they can write you a physical lab order. You can bring it to us, and then we'll schedule you a lab visit, usually within a couple days at the Wellness Center, and you wouldn't have to pay anything for your labs that way. Well, if you did it at the hospital or another provider's office, usually there would be a charge for that.
Okay, so let's say a person's going to another provider or they have an injury and they need to have some sort of rehabilitation or physical therapy. Can you talk a little bit about that?
Yeah, so we have a full physical therapy suite at the Wellness Center. It actually expanded quite a bit with the renovation as well. And we provide physical therapy every weekday at the Wellness Center with a number of providers. Anytime you pursue physical therapy at the Wellness Center, there is a copay very similar to if you saw one of the providers there, but it's typically much cheaper than if you would see somebody else in the community. And the other benefit to seeing us, besides the convenience, since we're right on campus, is that whenever you're working with one of my physical therapists, you're always working one-on-one with one of my physical therapists. There's no capacity expanders. So like if you were to see physical therapy somewhere else in town, a lot of times there would be multiple patients working with the same physical therapist.
Oh, like a class or something?
Well, no, there would be additional staff that would expand the physical therapist capacity. So like the physical therapist would talk to you and teach you what exercise or stretch or procedure you're going to do. You would start doing it. Then he would go to the next bay and work with that patient while you're doing your exercise. When you're at the Wellness Center, you're getting one-on-one feedback the entire time with my physical therapist.
Okay, very good. So I like that. I like that a lot. So can we talk a minute about preventative benefits? And I know that you mentioned diabetes and a specialist, a pharmacist. And I know one day I wanted to go in, I was just curious about my blood pressure. And the next thing I know, I was scheduling something with a pharmacist. And can you talk about that, and Vince, a little bit?
Yeah, that's Jenny. Jenny takes care of most of our blood pressure testing and monitoring. She works with both our on-site providers as well as some off-site providers to help manage people's blood pressure. And again, you can come in and make an appointment, or else sometimes just stop in and we'll get Jenny set up with you to test your blood pressure. Doesn't cost anything. We just ask that you come in, have a seat for a few minutes to know you're settled down before we do it. Okay,
very good. And then the blood pressure monitor is at pretty low cost to purchase.
Yeah, so blood pressure monitors, our site, I think they're like $15 for a meter.
Plus or minus $1 too, yeah.
Plus or minus.
Very, very good. Why do you think Notre Dame, why do they do this?
There's a couple of reasons. First and foremost, it's a great service to their employees. We provide really excellent medical care right here on campus that's easy for patients to access, but also the quality of care, at least in my humble opinion, is going to be quite high compared to perhaps somewhere else in the community. And so it's a great way to give back to their employees and provide this great medical benefit. On top of that, in a lot of ways, we help the university by keeping their patients healthier, and so by making sure that their employees have good access to good quality healthcare, it keeps their employees happy and healthy, which I assume helps their bottom line and keeps their employees productive too. And so it's a mutually beneficial relationship for both the patients and the university.
I love the convenience of being able to go pick up a prescription before or after work or at lunchtime and just being able to just walk right there rather than driving to a doctor's office. So this is, the pharmacy is a premise pharmacy. Do you know of other universities that have anything like our wellness center?
I'm unaware of a university that has a worksite division.
So I can't speak universally, but for Premise itself, the organization that I work for, Notre Dame is the only university within our book of business. That's about where my knowledge ends, unfortunately.
That makes us pretty unique, right? And so speaking of this uniqueness, what would you, Vince, I'm going to ask you this. What would you tell someone who hasn't taken advantage of the wellness center or the pharmacy, or who they're not fully taking advantage of? And what advice would you give them?
Well, first, I would just say come in and visit us and talk to us. We want to be friendly faces there for you. We happen to know more about your plan than anybody else and know more about healthcare than everybody else in the pharmacy network. So that's what I would say. I'd come in, talk to us. We try to build trust with people through our relationship building. And then from that, we can help you in all different ways. Whether it's figuring out which part of the wellness team you should meet with to help you with your blood pressure, work-life balance, stress levels, whether it's meeting with Anne related to your diabetes, and figuring out those resources that are available. Once we build trust with people, we can hook them into all the services we have at the wellness center and figure out what their needs are to meet those, whether it's figuring out whether or not they need to meet with the wellness team for work-life balance or to help them improve some aspect of their life, or do we need to get them hooked up with Anne to help with their diabetes education and improve their health that way. Or even sometimes to refer them across the hall to say, hey, this is something I can't help you with, but you need to see an acute provider, or else, hey, you need a new primary care doctor. We have those services available right across the hall.
Something that maybe not completely unique, but different than how most medical centers are run is that we spend a lot more time with our patients. And so part of the reason why I was attracted to come work at the wellness center was because as a physician, I was getting really disillusioned with corporate medicine of seeing 4 to 6 patients an hour. And it just really wasn't what I really pictured as being a good doctor was. Maybe I'm a bit old fashioned, but I wanted to get to know my patients. I like showing my patients pictures of my kids and talking about what I did over the weekend and things like that. And, if you're seeing a patient every 10 or 15 minutes, you really can't do that. And, besides the life satisfaction that's lost with losing those experiences, to Vince's point earlier, you lose some trust with that. If I'm just some guy in a white coat that you see once or twice a year for 10 minutes, you're probably less likely to trust what advice I give you or things that I'm trying to help you with. And it really sabotages the doctor-patient relationship. While if I'm spending 30 to 45 minutes with you every time I see you, and we're sharing life stories along the way while I'm giving you your physical exam or whatnot, I'm your doctor. I'm not just some doctor. And so, there's lots of data showing that improves clinical outcomes, not to mention all the more satisfaction that both you and I get from that relationship. And so that's what I really enjoy working at the Wellness Center, is that it gives me the opportunity to provide and have those type of experiences with my patients. And that's not something that you're going to get at most clinics in the community.
Dr. Garman, I think you're a country doctor. That's what I think. Well, thank you so much for taking time to, explain all these things and to share this with our audience. This is a great time to talk about open enrollment. Open enrollment is your annual opportunity to elect or change your medical, dental, vision, and other benefits for the 2025 calendar year. It starts on October 15th and continues through November 1st. Don't forget, if you report your annual physical in the Personify Health platform by Friday, November 1st, you'll receive a $140 premium discount in 2025. Also mark your calendars for the Irish Health Benefits Fair. You'll be able to interact with benefit vendors and campus partners, receive swag, and ask questions to help you make informed decisions for you and your family. The Irish Health Benefits Fair is Wednesday, October 23rd from 7 o'clock a.m. to 6 o'clock p.m. in the Danke Ballroom, 7th floor, Duncan Student Center. For more information, go to hr.nd.edu and search for open enrollment. The Notre Dame Wellness Center and Pharmacy is located at 100 Wellness Center, the corner of Wilson and Bulla, right here on campus. You can also visit NotreDameWellnessCenter.com for more information. We'll be back next time with more news and stories by and for Notre Dame employees. I'm Natalie Davis Miller. Thanks for listening to ND Works.